It's good to have you back. Now, today's World Patient Safety Day, and this year the focus is on maternal and newborn care. The National Blood Service plays quite a critical role in reducing neonatal mortality and further ensuring safe childbirth. Now, it says donor and patient safety is at the heart of what it does. Dr. Petro-Lize Wessels from the service joins us now to talk about this important day. Thank you so much for your time, Doc, and good morning to you. I mean, let's talk about perhaps this day and what it aims to do and why it's important for us to even have a conversation around World Patient Safety Day.
Good morning, and thank you for inviting SANBS to the show. I think patient safety is first and foremost in SANBS's mind every day of the year, but it's very good to have an initiative to raise additional awareness. In SANBS itself, obviously, patient safety is of crucial importance on the donor side as well on the patient side. And as you rightly pointed out, maternal and newborn safety is very important. And to this effect, SANBS has actually placed over 450 emergency fridges in all facilities that take care of maternity patients so that they have immediate and 24 access to blood should a bleeding put the mother in danger.
Yeah, and let's talk about your involvement as the SA National Blood Service. You've mentioned there the importance of blood, but I know it goes beyond, just blood. It has to be healthy blood, stored safely, and ensuring that it gets to where it's needed the most. How have you been ensuring this care as far as mother and child are concerned?
So it starts with taking care of our donors. Without our donors, South Africa would not have blood supply. And it's really important for us to put donor safety first. And what we have done is several initiatives. Our latest one is where we supply iron tablets to our donors who has donated just to replenish the iron that they have lost through the donation. This way we ensure a healthy, sustainable donor population, which in turn provides us with a sustainable blood supply. Talking about the product safety, there are rigorous testing, there are rigorous quality procedures, just to make sure that we have that safe product that you have alluded to. And on the patient side, obviously, we have a very widespread education and awareness program to assist the healthcare workers out there to ensure patient safety when they transfuse blood, and to make sure that they only use it appropriately so that we have enough blood everywhere, even in the most rural areas, should a mother need the transfusion.
Yeah, and I'm glad you mentioned rural areas, Doc, because my understanding is that the mortality rate between mother and child, particularly in rural areas, is quite high, isn't it?
Definitely higher than in the urban areas. And the role we can play there is to make sure if there's an obstetric bleeding, at least we have emergency fridge blood available 24 hours of the day.
Yeah, and just before I let you go, I know that you're also involved with the South African National Blood Services research projects. I mean, if we're talking about monitoring risk factors, influencing safe blood supply, whether medically, legally, or even ethically, what goes into your work, especially with these research projects? And what have you found that you think is particularly important to highlight? Briefly, please.
Thank you for asking. We're very proud of our research abilities. One of our most recent research projects is with the South African Breast Milk Reserve and the National Institute for Communicable Diseases. Now, the idea is to see that whether testing breast milk will be just as sensitive to pick up infection markers as testing a plasma sample of the mother. So ultimately, the idea is to supply our little newborn babies with as safe as possible breast milk and to see if we can do that in a non-invasive manner.
Sure. Well, we appreciate you talking to us today and also highlighting this important day for all South Africans to take note of. Thank you so much, Dr. Petro-Lize Wessels, for joining us from the SA National Blood Services.